welcome to Med Medicine with Miss P. I got some good stuff here for you today. I'm gonna try to run through pretty quickly here because as always, I have 100 more things to do. We'll start with the most common things that patients think exist or people think exist. I don't know that anybody can say hydrocodone correctly or oxycodone, and more often than not, they're just taking Percocet or Lortab, but they don't. They think they're taking 325 milligrams of Percocet or oxycodone, or 325 milligrams of hydrocodone, which of course is a deadly dose, but they'll never believe you. So this person combines some things there. They take hydrocodone. So maybe that is iodine with hydrocodone. I don't know, but and the thing is, like I've said before, as you're typing the medications in, because they're doing this online now, as we all have to, it will stop you. Like if you are putting a letter in, it'll give you 100 different choices, and then the next letter will kind of narrow those choices. The next letter will narrow those choices, and so on. So surely when you get to a certain letter and you're missing a letter and all of your choices go away, you got to know you're inventing words here. But they don't. They do it all the time. Just like Lorenzopril. That's if Lorenzo Lamas comes over and helps you with your blood pressure. Lorenzopril. Again, as soon as you start typing LAR, you would think that's, I mean, there's probably a couple medications, and then when you start adding INZ, there's no Z in lisinopril at all. Like if I would go get my bottles and just type it off the bottle, but they don't. And then this other patient put in lisinopril 2-20. I don't know if that's a combo med. Maybe that's two different medications in there. I mean, I don't think so. I don't think anything is 2 milligrams. Maybe they just mean they take 220 milligrams, so they take 40, but didn't want to do the math. I don't know. And every time I'm talking to them and they say, let me see here, I take a 100 milligram tablet, but I cut that in half and I take that twice a day. I say, okay, so you mean 50 milligrams twice a day? No, it's 100 milligrams. Right, but you told me you cut it in half. So you take 50 milligrams in the morning and 50 milligrams at night. So that's 50 milligrams twice a day. No, I take 100. Okay, so you're not cutting in half? No, I cut it in half. Okay, wait a minute. And now she's thinking. And then she comes back like forever later and says, "Oh, okay, you're right." It's just 100 milligram. Like, I'm not asking you to cut a 75 milligram in half and do the math there. It's a 50, just enough. And then this other patient said, I was asked, are you taking any other medications, lotions, creams, ointments, inhalers, nasal sprays, eye drops, ear drops, patches, nebulizer treatments, injections, anything like that? Because I kid you not, I will get to the end and then I'll ask them if they're diabetic. And then they'll say, oh yeah, I take insulin. Like it wasn't a medication. Like I literally just asked you 2 minutes ago, what other medication? And they'll have an insulin pump and like not mention it until they come in that day. I don't understand how that happens. So I said, you take any of the medications? No. How about anything over the counter, vitamins, mineral supplements, herbal treatments, anything like that on a regular basis or even as needed? Oh no, I can't because of my insulin pump. You can't take vitamins because of your insulin pump? Yes, the doctor says I shouldn't take any vitamins because of my insulin pump. Which doctor are you going to? I don't think there's any vitamins that affect your insulin pump or your blood sugar for that matter. I don't think that's a thing. And then we continue on the rest of the interview. Turns out she drinks alcohol every day. She drinks alcohol, pure sugar, every day, is an insulin-dependent diabetic with a pump, but thinks that vitamins will affect her blood sugar. I don't know. And I do have, there's a little spot there where you write in the name of your surgery. Which surgery have you had, the date, like the year, just round it. If you're off by 4 or 5 years, it's fine. Just give us an average. And then was it general, IV sedation? Did you have an epidural, like a spinal epidural, like with C-sections and stuff? Not only do they think everything is done under sedation, like a complete colectomy is done under sedation. I would like to see that. I would like to see the person with IV sedation having a complete colectomy. I probably don't want to see there'd be a lot of screaming, but this patient wrote in that they had a face repair. That was their surgery. They had their face repaired. Yeah, I've had my face repaired also, but I don't really know. You're gonna have to be a little more specific than that. Your face repair. Turns out after talking to him, he had this like massive car accident and needed like 3 or 4 reconstructive surgeries. That is a straight up repair. But it's not so much that it's the face. I mean, surely we're talking about, bone structure and stuff, but I was able to kind of, fix it up and put it in there and be more specific. But um you can't just chart that you had, or they'll write elbow, my left elbow, and they never write a side. I don't know what I'm thinking. They never write a side. They'll just say like knee replacement. We'll just look for the scar, I guess, and figure it out. Or they'll write in shoulder. Yes, that is a body part. Good. Head, shoulders, knees, and toes. But what happened? Would you do anything? Just body part. They'll write colon surgery. That's not a surgery. That's a part of your body, but that's okay. So this one lady I talked to, I didn't write it down though, so I don't want to forget to tell you. I talked to her yesterday, and it was crazy because as I was going through it, I was kind of look through their form and make sure that they're not missing anything, and they always misunderstand this one part. It clearly says, when is the last time you had any aspirin or aspirin containing products, such as all of these things, and what was the last medication you took? Now I don't know why that's in there. There's a lot of it on this form that I would change, but they always write in like the last medication they took, no date. They just write in like metoprolol, or who are we kidding, metoprolol. Or they'll write in there like their last medication was estradiol. I'm like, that's not what the question asks at all. That's not at all what the question asks. It literally says, when is the last time you had any aspirin containing products? They never fill it out correctly. But this one lady, she wrote in as, like extra information we should know, because I was kind of scanning it before I call, and it said there's a bullet in my liver. I'm like, oh my gosh, like how did that even happen? And as curious as I was and as badly as I wanted details, I I had to get going, and I couldn't sit on the phone, unfortunately. And I didn't want to be intrusive. I didn't, want to say like, oh, tell me the whole story, even though I was dying to know. Her neighbor shot her like 9 times. And I really want to say, well, what was it over? What was the situation? Or where do you live? And I couldn't get into it. I'm hoping if I see her in person in the center, I can, ask her. But oh my gosh. So yeah, we had some extra surgeries to chart in there that she kind of left out. But wow. Um, Also, this is one of my favorites. My boss came in my room. She handles all of the knee replacements, hip replacements, all of those patients. Thank God I don't have to do it, because it seems very, very involved. Like the pre-op, the post-op, it's a lot. You have to really make sure you know what you're doing when you're having this procedure, and you have to follow the instructions. I know it's almost impossible for people to do. You have to read the instructions, comprehend it, ask good questions, and then take good care of yourself afterwards. This is a pretty big deal. So I guess she called to get their health history, and he's like, well, is this going to take very long, and how many questions is it? And I'm very busy. And she's like, well, we have to do this. You're having a pretty big surgery here. We need to know these instructions, and I need to give you these instructions. I need to know this information. It's for the anesthesiologist to safely put you to sleep. And that's what we always say. It's for your safety. It's not for any other reason but for your safety. Nobody would do this if it wasn't for patient safety. It's torture. So he says to her, she says, well, we also have to have your blood drawn, and we have to do, this and this and this. And he goes, well, do I have to come in for that? Are you asking if you have to come in to have your blood drawn, or if we can do that over the phone? No, you have to come in to have your blood drawn. The look on her face when she said that he asked if I had to come in to have my blood drawn. Come on. It's a little funny. The look on her face was priceless. And she's like, yes, you have to come in to have your blood drawn. Maybe he meant, do I have to come into your facility? Surely he knows we cannot draw his blood over the phone. Now listen, AI is freaking me out, and there's some stuff it can do, but surely this is not one of them. Do I have to come in for that? Yes. Yes, you have to come in for us to draw your blood. Bless him. Okay, so I listen to all of these true crime podcasts and videos, and they're horrific. They really are. I need to stop, but they're interesting. I also feel like they're kind of keeping me safe, because I know what to be careful of and look out for, because you don't know. You may feel like you're watching your back, but maybe not as much as you should. So I'm listening to this podcast, and it's about the dialysis clinic, that nurse that was killing everybody. And it's probably not just the one, but the one I listened to. And I really don't even know where it was. I think it was like in Cleveland. It was someone somewhere far away from here. But anyway, it's the podcast guy who's, narrating this. And he said that she was putting a lot of the blood thinner into the machine and it causes cardiac arrest. So I don't think that's a thing at all. I don't know what kind of anticoagulant or how high of a dose it would take. I would assume that you would have like massive internal bleeding before your heart stopped, but okay. And I never really understood what he meant by that anyway, because actually she was putting this like bleach solution that they use to clean the machines. She was injecting it directly into the patients. So I don't know why they think that the blood thinner, and I'm quoting, was being injected and causing a cardiac arrest. That's not even, I don't, I don't see how that's even ridiculously correlates. But anyway, okay. But they also said at the same time, this in the same podcast, I had to stop what I was doing and write it down. He said that she graduated as a nurse with her license. Wouldn't that be great? Could you imagine if you just graduated nursing school and then bam, you have your license? You don't have to sit for boards. You don't have to pay the $250. You don't have to do anything. You just graduate and then here's your license. You're just automatically a nurse. You don't have to test any knowledge. You just barely got through school and here you go. You can go take care of people. Yeah, no, that's as far as my knowledge, that's not true in any state in the union that you graduate as a nurse and then just you get your license. I'm pretty sure you have to sit for boards in every state. And if they're not skipping boards entirely in these shows, these videos I listen to, they think there's many boards afterwards. After she takes her nursing test to get her license, like there's multiple tests. I'm like, it should be just the one unless they're going for something else, but they never get it right. And I just kind of eye roll and move on. And also in this same one, I told you how to write it down. In the same one, all of the patients there for dialysis was because of their diabetes. No, that's not how that works at all. I don't know what people I'm a little part of me is kind of curious, like, and it happens to me. It happens to me when something comes up and I'm like, oh my gosh, I always thought this. I didn't know that, So it is really interesting. But these, I just feel like, and maybe it's just because I've been a nurse for so long, I just feel like some of these things, when it deals with like your own body or family members, you should have a little bit of an idea of how these things work. And you don't go to a dialysis clinic because of your diabetes. That's not how that works at all. Like not even a little bit. It's not going to help your diabetes. It's not going to change your diabetes. You have diabetes, and there's many things you can do to help treat and work with it, but dialysis is not one of them. So what I'm guessing is that they think you need dialysis because of your diabetes. So still no, right? Not at all. So all of you who are my previous students, you know darn well exactly how that works, right? They either had uncontrolled diabetes, most likely coupled with some hypertension, for long enough to where we not just pressure clean, but we sandblasted the delicate fibers and vessels to their kidneys, leading to chronic kidney disease, kidney failure, and now, stage 4, you're not making any urine and you need dialysis. It's not necessarily because of diabetes. It could be because of uncontrolled diabetes. Now, there are some out there that are just very difficult to control, and those are our brittle diabetics, and that's true. They eat one bite of something, their sugar jumps up, they have 2 units and their sugar plummets. Like, I get it. But on average, if you take good care of yourself and you take good control of your diabetes, you should be able to keep your toes, your feet, your organs, and you don't have dialysis in your future unless you make poor choices down the line or are just, critically ill in other areas. Okay, so the last one I'm going to leave you with, if I have to have the visual, you will too. A lot of these patients insist on telling me things that I wish I didn't know. They'll ignore some stuff and then tell you TMI on other stuff. So the 79-year-old male I was talking to, go ahead and picture it, 79-year-old male, right? He's giving me his list of medications. And fortunately, most of them are the generic, so I don't really recognize them right away. So as I'm kind of typing them in, and, these options, and sometimes I've never heard of them. So I say, can you read that to me from the bottle so I don't have to use my phone or slow down? So I just say, can you, tell me what you got there? And as they're typing it in or saying it to me and I'm typing it in, it comes up with a milligram. They're like, yes, I take, 20 milligrams, whatever it is. I really don't know, as needed. And then to make sure that I know I'm not missing anything, cardiac or kidney or anything like that, I'll look it up. And it's often the generic for stuff like Viagra and Cialis. 79-year-old man taking Viagra as needed, quote, end quote. Which, kudos to him. That's great. But now I have the visual, and now you do too. So you're welcome. That's my gift to you. Almost 80-year-old man popping a Viagra when needed, which is great. That's good for you. I'm happy for that. Okay, I got to get out of here. My son promised me he'll let me pay for a haircut, and I'm very excited for him to get a haircut because there's so much hair. He has so much hair. It's why I hated the 60s. All of the hair, there's so much uncontrolled, greasy, curly hair everywhere. It's a lot of hair. So much hair. So as always, face your fears, forget your failures, follow your faith, and I got plenty more pages next time. So I'll see you then. Hugs and kisses.